Mini Mini Derm Update was born out of a necessity to close the gap between March of 2009 in Montreal and the next regular Derm Update in Vancouver in November of 2010. And the attendees in 2009 were polled, and this was a determination that would surfaced after we checked with what the registrants wanted in terms of the information on new products and devices that have or will take place in that interval. At the end of 2009, as so often happens, both the Health Protection Branch and the FDA, in the months late in November and December, I think to avoid too much bureaucratic complaining, accelerate the acceptance process. So drugs that have been held up in a long queue suddenly are released. And this gives the opportunity early in any year for a lot of discussion on new agents. One of the lead examples is the Graceway, a Mi'kmaq permission to go forth. Now, they have, with this immune modulator, a new dosage formulation, which should prove to be advantageous. The drug itself has a good track record. So that's one example. There are several others. Now, believe it or not, drug regulatory agencies, apart from the Health Protection Branch, do impinge on what we in Canada believe how we treat our patients. So what happens in the EU or with FDA, quite apart from the Health Protection Branch, has a very, very dominant role in how we envision a new agent. So very often, dosage considerations, side effects become known before they even go through the regulatory process here in Canada. And then there's also the matter of the cost, drug cost. And if the drugs that we're getting now are quite pricey, that is telegraphed to us well before we experience the actual cost here in Canada. We know that we're going to make 3 changes. One, we're doing everything we can to make certain that update reflects the changes that are going on within the demographics of Canada and of dermatology. That means women who now form a preponderance of our resident population, dermatologic resident training population, to be perfectly clear. They're now nearly 60%. And among practicing dermatologists, women now are approaching 50%. So that shift has got to be reflected in the kinds of program, content, speakers that we involve at future updates. Number two, we're increasingly aware of drug costs, and we're making an attempt to engage dermatologists in thinking about the process, because the decisions made by provincial formulary bodies are sometimes not very transparent. That's putting it mildly. And we want, if we can, to make certain that the practicing clinician in dermatology, the academic and industry are all very aware of exactly where everybody stands with regard to the need, the cost, what the process can bear, and how really effective, clinically effective is this new agent. And these are some of the factors that we want now to really advance within Dermatology Update to make certain that all these three different sectors in the process are involved.